All right, I'm a couple of minutes early, or like 30 seconds early, so not a couple of minutes. I'm a little bit early, just waiting for this to build, for people to jump on. I'm stuffed up because we had way too many animals in the house, and so I'm stuffy. So I may sneeze here and there, but I'm not actually sick. You can see the little wiener dogs behind me. I'm home. I'm in my sweatshirt, my hoodie. I'm comfy because it is my day off, and so I'm now just chilling out in my hoodie, my Bubba Gump hoodie that I got when we were in Florida. Actually, that Ashley got me when we were in Florida. So I'm super comfy and warm. I know, right? I literally just plugged you. I was like, Ashley got me this. We went to, where the heck did we go to, Ashley? To the wrong place. That's where we went. We went to Universal, but it was the wrong Universal. And then at the end of the day, we went to Bubba Gump for dinner, but it was very cold. So she got us hoodies. She's so cute. All right, so waiting for this to build up, a couple of minutes, and I'm gonna dove right into it. This is gonna be a good one, folks. It's gonna be a bit of a warning, and also some information to the fish aquarium where you got the fish lips. Hanny, I'm tiny, you know? You realize what profile you're on, right? You realize you're on my professional one? So be super cool if you could not be a fuck nut. That'd be great. Cool, thanks. There we go. Now you can't comment because I blocked you from commenting. Perfect. Yay! People are idiots. Even my friends. Can you hear me? Yes! Woo! Okay, this thing's crooked. I'm trying to hang it up here, but I'm crooked. It's fine. Whatever. Tiny's actually a friend, but sometimes he makes comments just because he thinks he's funny, but he's actually not funny, and I'm just like, man, like, you're on my professional one. Like, fuck off. But he doesn't get it. He was on earlier, and he got told, and so now I'm just gonna, like, take people's ability to comment away when they're idiots, because they don't get it, and yeah, that's what I do. So, let's delve into this. Okay, so those of you who have been following me for a while, or years, or whatever, you know that hormones are my jam. It's what I do. Men's hormones, women's hormones, hormones. Anyone who's got hormones, that's what I do. It's a passion. I've been doing this since 2010. That's a long time. I've seen a lot. I've seen people abuse hormones. I've seen people get synthetic hormones. I've seen people on the wrong doses of hormones. All of these things are kind of par for the course. You know, if you're someone who does steroids, who does anabolic steroids, do yourself a favor, know the source of where it's coming from. And unless you're getting something that's bioidentical, that's coming from a script, you're probably not going to know the source. That's my little person running around who I told to go to her bedroom and hang out, but she's not. She's playing with the dogs. So if you see a little person, that's my mini. So here's the scoop. I have a lot of friends who do anabolic steroids. I have a lot of colleagues who do them. I have acquaintances who do them. Hey, Nick, you know what? It's your personal choice and it's fine. You do what you want to do. You're going to be competing and you're in a competition that allows you to do steroids. That's fine. I don't care. There's so many actors out there who are on the juice and they're saucing it, but they're being smart about it. Sydney, go sit down, please. Okay, thank you. Very kind, thank you. Go. So here's the thing. If you're not monitoring your liver enzymes or your kidney enzymes or any of the other enzymes and your follicle stimulating hormone, your luteinizing hormone, that's your FSH and your LH, you're not looking at your prolactin levels, like, you need to monitor to know what's going on. And if you're not doing that, that's a problem. You can be killing your kidneys, you can be messing up your liver, you can be doing a lot of damage to a number of systems within the body. Now here's why I'm doing this live feed. Not because people are doing anabolic steroids and I give a shit. Do you, boo? It's fine. I monitor people who are doing it. on a professional level who are doing it very smart. Does it mean I support it? No, but it means that I'm helping them monitor so they know what's going on, because I'd rather you be doing it safely or as safe as possible and supporting you through other, HCG or whatnot, through my nurse practitioners that are on my team that are watching over you and saying, hey, you're aware of what's going on. This is what you need to do to support that. You need to protect yourself for these ways. At the end of the day, there's an issue. Right, Becca? Yeah, use isogenics because it's super healthy. Not according to the kidney enzymes after being on it for like 3 months. That's a whole other ballgame. That's a whole other live feed, tell you that. So here's the thing, and this is specific to Ottawa. I have colleagues of mine, because it's not just my team. I work with a team. We're part of the same practice, but I also work together with other people who are not on my team, but who are in the medical field. And here's what we are seeing. And I'm getting the messages. I got a phone call today. I got one over the weekend. I got another one last week where people were saying, Holly, are you seeing this trend? Are you seeing what's happening right now? And of course, me being me, I'm like, all right, well, what's up? What are you seeing? Huge issues with LH, FSH, a number of the different markers going through the roof, going crazy, super duper permanent damage being done because people are doing anabolic steroids here in Ottawa. And I don't know who the source is that they're getting it from, but there's one particular place that they seem to be getting it from where it's a small portion of what you're trying to get and the rest of it is something else that's adding it. I don't know what people are cutting it with. We don't know yet what that additive is. We're trying to find out, but it is fucking people up. Sydney, I want you to go now. That one. Right now. Thank you. For me, this is an issue because it's permanent damage. You're doing permanent damage because you're getting it in a brown paper bag off of a street corner. You're getting it from maybe your personal trainer. And maybe your personal trainer is assuring you that this is clean stuff from a good source. But he's not a doctor. She's not a doctor. She is not qualified to know what the fuck it is they're giving you because they're not a nurse practitioner. They're not a doctor. They don't have prescribing capabilities. You're getting it off the street. You're a fucking drug dealer. Period. You're a glorified drug dealer because you're giving people shit that's been cut with something else and you're fucking them up for the rest of their lives for a competition so that they can look good, win a medal on stage, and you get more clients. Because you're gonna look like such a great guy or such a great girl because you trained these people, and there's a female trainer in this city who you're fucking lucky I'm not calling your name out, who's doing the exact same thing, only worse. She's giving people a drug that we give to cancer patients, tamoxifen, to block the estrogen so they can cut their water weight so much quicker, and forcing people to do it. There's 3 people in the last 6 months that have come to me who've seen this person, who've been training for a competition and been told that they had to take this, and when they were told no, kept at it pushing and pushing and pushing. You know what that does? Let me tell you what that does. That pushes you into menopause. Welcome to early menopause because you listen to your fucking trainer. Your trainer's job is to do one thing and one thing only. Fucking train you. Period. Unless they have some sort of a nutrition degree, and I don't mean like I took a weekend course and I know 16 ways to prepare kale. You're not a nutritionist. Shut the fuck up and sit the fuck down. Stay in your lane. Take a real nutrition course. Then yes, do meal plans, that's great. But your meal plan doesn't include tamoxifen and anabolic steroids. That's not a food group. It's true, people are obsessed with getting bigger and stronger. Ugh, I can't even imagine. They don't know what they're dealing. They're trying to make a quick buck or they're trying to make a name for themselves. And there's a part of me that's like, okay, great, you're doing it to make a quick buck. But the ones that are doing it not necessarily for the quick buck, But to get their name out there, to be a big Instagram celebrity or a Facebook celebrity, or to be a name out there as somebody in the industry, as a trainer who's got their clients that are winning competitions because you're doping them, because you're giving medication to patients that is going to propel them into menopause. You're in menopause now. Maybe you won your competition. Maybe you didn't. Maybe you came in second. Maybe you didn't place at all. You're in menopause. Now what? Exactly, Kelly. Even as a breast cancer patient, you refuse tamoxifen because it's a shit show. Now you've got a healthy, happy woman who's in her early 30s who's taking it. You're in menopause now. You're 30. You're 33. You're 37. You're 42. What if you're my age, 40, 41, and you take it? I am nowhere near ready for menopause. Let me tell you, my hormones are awesome. If I took that shit, I'd be in menopause. Whoa, hold up. No thanks to the hot flashes and the estrogen shit show and like the sleep issues now, the fucked up DHEA, like all of the stuff you're gonna go through. Goodbye libido. Oh, and hello midsection fat, because you messed yourself up. So now you're gonna balloon. The second you step foot out of that gym or alter your diet and eat real food, you're fucked. Why are we doing this? Like, why are we doing this? To win a competition? You can win that competition. You don't need to take a medication that's designed for cancer patients, that certain cancer patients don't even take. They refuse it. I know many that do. Case in point, Kelly above, as per her comment. You know, and exactly, Mandy, what about the 18 and 19-year-olds that are trusting their trainers? I can tell you right now, that same trainer is giving those age group, hey, we're going to train you for a competition. I know a 24-year-old who was put on it. She was like, well, I didn't know what it was. And she told me to take it and said I'd like cut weight really fast. So I figured it's like a weight cutter, like hydroxy cut. No, that's not what it is. That's not what it does. FYI, with my heart issues, the oncologist would not give me. Yeah, exactly. So here's another thing. Does your personal trainer understand that you have a heart issue or certain other factors? Like, did they run a blood panel on you to see how healthy you are? Do they know a basic CBC panel? Do they know where all of your different functions lie? Like, are you healthy enough to take this drug? Should you be, what's your cancer risk? How are your genetics? What are your hormones doing right now? What about all of the other factors? What if you take it and you have a heart attack? Is that personal trainer liable? Well, I don't know where they got it from. They didn't get it from me because that was cash in hand and it never happened. You're not protecting yourself, people. It's a big deal. Super big deal. Yes, absolutely, Sue. From a personal trainer. And I'm not even really sure what that person's background for personal training is other than they did competitions themselves, which apparently makes you a personal trainer from what I've seen online. Not sure about the PT course that they did or didn't take because it doesn't really look like they took one. And if they did, maybe they need to be reported for being a drug dealer. Now, I know some people are like, well, what's the big deal? Anabolic steroids, blah, blah, blah. Listen, like I said, you want a dose, go for it. You want to do your thing, I'm fine with it. But there's a fine line between doing something to increase performance, to enhance whatever, and hurting yourself. And when you've got a personal trainer that's forcing this on you for a competition, that's a big problem. And when you've got somebody who wants to do anabolic steroids and is like, I'm going to just do a little bit just to tweak something or whatever, I'm not against that. I'm not against tweaking the human body. Look, I'm all for it if that's what you want to do. I just feel as though maybe what we need to be doing is being a little smarter about it. Go see a professional. if you want to boost your stuff up, and tell them, I would like to optimize my hormones, please, in a safe and effective way. You'll get those muscles. Oh, you might have to work for them a little harder, honey. Such is life. Really? And at the end of the day, if you want to boost it because you're doing whatever, also totally fine with that. Look, us women enhance the shit out of our bodies all of the time. You want to fucking enhance yourself, bro, you do you. I'm totally okay with it. My issue is that whatever is on the street right now in the past month is hurting people. It is being cut with something that is messing you guys up. So your shit you're getting might not be the same shit you were on before. It is causing issues, huge issues. Difference is the same as a crack dealer, even worse. Yeah, you know, I have experts who do the prescribing in my practice. I don't prescribe bioidentical hormones. I'm not the one prescribing. I know what your levels are supposed to be at. I know what your dose will probably be, but I'm not the one prescribing. And you know what I also don't do? I also don't say to my patients, you should probably be on 150 milligrams of progesterone. I wait till the qualified person, the nurse practitioner, says, I'm going to put this person on 150 to 175 milligrams, days this through that, and then 200 days that through this. Because they're the ones who are prescribing and I stay in my fucking lane. Sure, I know the answer, but I'm not prescribing it. So I'm not going to step on someone's toes. If I think the dose is wrong, I would discuss it with the nurse practitioner and say, hey, do you think it's a little bit high, or do you think that we could bump it a little bit higher because she complained of these symptoms? But I have that discussion with the expert who at the end of the day makes the decision of, I kept it at that dose because, oh, okay, perfect. That makes sense. Because she knows what she's doing, or he knows what he's doing, or they wouldn't be part of my practice if they didn't. I went to see a specialist, Ashley. She would help me. Test my levels were 50. Able to raise to 185. She said I didn't qualify for TRT, HRT. However, I've read about testosterone spiking, so I'm hopeful, but I will plateau eventually. Testosterone and hormone replacement therapy, from a bioidentical standpoint, the levels, we tend to optimize them. Sometimes the labs aren't really reflective of what's going on. So this is where, Scotty, it comes between, excuse me, treating the person, not the paper, versus test, don't guess. You're going to look at the test, look at the numbers, but then also have a conversation with the patient and say, okay, he has no libido, he's really tired, this, that, and the other. What about your sex hormone binding globulin? Are we testing that? What is your LH? What is your FSH? What are all of the other numbers saying? And what does that picture look like? And then maybe we do top up to optimize the levels despite what the labs say. Because when you go to your GP, they might say you're within range and have a good day. Whereas when you go within private practice for functional medicine, we're a little bit more lenient within reason as to being able to push that envelope safely. Let's say a man is at risk of breast cancer and tissue removed from chest. And sorry, I'm trying to read. Carlos, let me read this here. Tamoxifen, are they at risk at take? So, I'm not quite sure I understand your question, Carlos. Are you saying that you have a risk of breast cancer? The tissue is removed as a male and the breast cancer doctor prescribed tamoxifen. Is there a risk in taking it? Of course there's a risk of taking it. You're taking it prescribed by a doctor, so have that discussion with your doctor as to what the risks are. Always ask, what if? What if I don't take this? What happens? What if I do and I have side effects? What do those look like? Always say, what if? Anything that a doctor prescribes me, I always come back with, what if I don't take this? And a lot of cases, it's, well, nothing. Or, well, you could push it another 3 to 6 months and see if this improves, and if not, then we can reassess and then prescribe. But it's never been a, you have to take it and you have to take it now. There's always been a discussion. So ask your oncologist, do you have to take it? And if you would like to not take it, what are the what are the side effects of taking it? What happens if you don't? You and Bubba Gump's sweater is the palms. I know, right? My mama says I'm special. Maybe Ashley says I'm special because she bought it. Scotty, absolutely be in touch. Aw, thank you. All right, guys. So yeah, not saying that doing the antibiotics, steroids, or dosing or whatever is bad. I'm not saying that. I'm saying if you're testing and you're watching your levels and your enzymes and everything else, hey Lola, and you're doing it properly, then it's fine. Enhancement is enhancements. Whether you're getting your boobs done, or your lips done, or you're getting an ass injection, or a guy's getting a six-pack implant, I don't give a shit what you do. Enhancement is enhancement as long as you're doing it safe. You're not gonna go to a butcher to go get your tits done. Why the fuck are you going to some hack job on the corner who's a drug dealer to get your hormones? Because you never know what you're gonna get. It's not always gonna be the same supplier, and else you're the one meeting the guy bringing it off the boat from Mexico. You don't know what you're getting. And things are being cut like crazy. And the stuff that you were getting that you thought was safe is all of a sudden a different ballgame. Because if it was the same shit, those of us that are treating those patients, that are monitoring their lab work and seeing what's happening, have all of a sudden seeing a massive shift in the luteinizing hormone and the follicle stimulating hormone and a bunch of other markers where it's like all of a sudden they're completely out of whack, and we're going, whoa, well, what did you do? What did you change? Well, nothing. I cycle on. I did this. I'm here. I'm taking that. No. Same stuff as always, doc. Yeah, but it's not, because this is happening. So then you stop it and it all reverses and you go, whew, dodged a bullet there. So, unless you're getting it from a compounding pharmacy, you don't know what you're getting. Or even a regular pharmacy. Testosterone is testosterone is testosterone. If you get it from Shoppers or you get it from the compounding pharmacy, it's the same testosterone. If you're looking at bioidentical progesterone, then yeah, you know what? Shoppers, not the same progesterone that you're going to get from Trutina, which is our compounding lab. There's going to be a difference. So some things, no difference. Some things, big difference. But getting it off the corner, that shit ain't the same. I'm telling you right now. I've seen horse meds being given to humans. Horse meds. Horse meds. I'm not a horse. Are you a horse? I'm not a horse. I just shake my head because, we're 30, we're 40, we're doing this stuff, we're trying to improve, we're in our 20s, that's even worse. Dudes, you want to have kids someday. You're in your 20s and you're fucking with your testosterone, good luck with that. Good luck with that. And else you're taking what you need to take to protect yourself, good luck with that. Thanks, Lola. They're still puffy. I just can't stress it enough, guys. I really can't. If you're in Ottawa and you're getting your steroids off the street, just be very aware that there is a supplier out there. We don't know what they're cutting with. We don't know what their filler is or what they're adding, but it is creating a massive spike in certain elements of the blood work that we're doing. And if you're not monitoring, you'll never even know. Not knowing is necessarily, it's a bad thing in this case. At least if you find out, then you can say, oh shit, you can stop and you can do what's called course correction. Where you are driving and you go off the road, you correct your course to get back on the road. So again, it's not that I'm shitting on those of you that are doing steroids, because I don't give a crap. As long as you're monitoring and you're doing it safely and you know what you're doing, I don't give a fuck what you do. If you're doing it and you want to have kids, be aware that you got to be really careful, because you can be at risk of not being able to have kids or have more difficulty of having kids down the road. If you're at that age bracket where you're like 40, 50 years old, you're doing it to, for the health of your joints and to keep your body together and for that extra boost of muscle mass, good on you. Totally okay with that. Again, monitor so you know everything's where it's supposed to be, that your heart's good and all your other enzymes and all the other elementals are okay and within range to where they should be, so that you know that you are on watch and you don't want all of a sudden have a heart attack. ketamine is given to cancer patients for pain, which is a horse medication. Yes, but it's not equinine. So Trutina, I give that as an example because that's our compounding pharmacy. They do a lot with equine. They do a lot with horses and horse medications. And well, same with the vet. A lot of the prescriptions that we have are the same as a human would use, but there are some things that are specific to, like, let's look at estrogens, synthetic estrogens. They come from horse urine. None of the different types, the 20 plus types of estrogen that are in your birth control that are coming from a pregnant mare's urine look like what a human's urine or a human's estrogen should look like. It doesn't look like that. So our body's like, I don't know what to do with this. This is kind of where I'm going with that. Yeah, ketamine. We're using a lot of the ketamine creams. We're compounding for pain to patients in general, not even just cancer patients, but patients in general. Absolutely. So it's not just for horses, although it's more commonly known to be used as. There's a lot of things we use that are human that is used for animals, and vice versa. This isn't something that should be, though. I guess that's it. I guess that's all I had to say. And yeah, don't take tamoxifen if you're doing a competition, ladies. Unless you've had breast cancer. And your doctor prescribes it. Like, what are you doing? You're going to propel yourself into early menopause. Just don't. It's horrible. I'm seeing a lot of patients that have taken it and they're not coming back from it. They're not bouncing back. They're like, I only took it for a short amount of time, and they're not bouncing back. They're like, I just don't feel like I did before. Yeah, that's great. Awesome. Was the competition worth it? Is it just the steroid being cut or others drugs? You know what? So far, what we're seeing, it's just the steroids. It's the anabolic steroids that are being cut, of writing that are being cut. We don't know what they're being cut with yet. We haven't figured that out, but there's a group of us that are looking into it. So we'll see. Yeah. We don't know what. I mean, it's not like it's being cut with fentanyl or something, because that's a different ball game. But whatever they're using is something cheap, and it's messing with the labs. We don't know what it is, though. And that's what's being cut. The tamoxifen, to my knowledge, is somebody's getting a prescription for it, getting it filled, and just passing it off to this trainer, I'm assuming, or black market. I don't know, because everything I do is pretty legal, so not really my wheelhouse. But wherever this person's getting it from, it's bad. Oathmain wants to be in your video. No, I don't know who you are, so I'm not going to put you in the video, but thank you for requesting that. All right, guys. Any questions for me? I know this was kind of broad and everything else. Ketamine is given to people who are admitted into emergency psychiatric clinic for high suicide risk. I didn't know that. Really? We use it in practice for pain. I know that. Ketamine creams that are compounded for pain, like elderly with arthritis and stuff. That's pretty cool. I did not know that. Really? Interesting. Bye, Lola. That's interesting to know. See? Even I learn things. This is why I love my tribe. There's always somebody on there that knows something that I didn't know. That's going to be a cool little piece of information. My child walking back and forth with the puppies. Can you put them down, please?
Mommy?
Yes?
They chewed my sister's crayon. One of them.
Why is the crayon on the ground?
It fell.
Okay, well, you got to pick it up, okay? They're puppies, and puppies chew things.
I know. We don't, but...
All the joys of having children and puppies. Very effective to relieve depression quickly. I did not know this. So I don't do a lot in my practice with depression, other than with the microbiome aspect of it and CBD. But other than that, I don't really. I always it's a little outside of my wheelhouse, so I always refer out for that. And a lot of my clinicians that are on board, that's also it gets pushed back to the powers that be. Thanks, Kelly. Yeah, the puppies are a handful. They are friggin' adorable. They're busy, very busy, but we love them. They're pretty cute. Where your clients on testosterone as well as anabolics, example, DECA, Tren. So the patients that I see are on like everything, but they were cycling. So those particular ones were, they were cycling on and off of different things. Some were on Clem, some were on DECA, some like a whole bunch of different kind of whatever. It seems to have been some of the testosterone, but it seems to have been, I don't know if it was the Clem or the DECA, I don't know which one it was from the other practitioners. It was just simply, they were like, it was the anabolics that were the issue. Dawn, what? I don't know what you're saying, what? 2, simple tip, when hiring a trainer, do your homework on them. If they try to push drugs or D-supplements, get rid of them. Oh, and supplements. Yep, agreed. Ketamine infusions are being used in the States to treat severe OCT. That's cool too, Sue. Did not know that. Okay, that makes it hard. Yeah, it does. It's anabolics. That's all we know at this point. Is it prescribed versus over the counter? Monique, are you talking about the anabolic steroids? Is that what you're talking about? Anything like prescribed versus over the counter, none of the stuff that I'm talking about is over the counter. OTC means you don't need a prescription for it. Anything that I'm talking about in this video needs a script from an authorized, whether it be a licensed physician or nurse practitioner. You cannot obtain it over the counter. There is no OTC version of this stuff. You're talking about testosterone, you're talking about hormones, you're talking about prescribed hormones, which we do in the form of bioidenticals, by script, after assessment by blood work. We're talking about tamoxifen, which we don't prescribe because we're not oncologists. So, all prescribed medications, which is what makes it scary, because why is somebody doling out prescribed medications when they are not a doctor? A little scary. Hey, Tatiana. All right. Any other questions before I jump off this thing? Let me know. If you want to get tested and you're doing some stuff and you're not sure if what you're doing is right, or if maybe you're a little concerned right now with the stuff that you're doing messing up your hormones, you know, you're more than welcome to come on board. I don't have a judgy practice. I'm pretty open. You would be very surprised at the shit that I see within my practice. We have people that are on cannabis therapy. That's fine, we do that. You want to smoke a little weed, smoke a little weed. It's fine. It's legal now. Nobody gives a shit. You do you. If you're on steroids, I have patients who are on anabolic steroids. I have patients that are getting it from kind of like wherever, and they come to me and they go, now I want to do it right. There's course correction we can do. You know, I work with some amazing experts, and that's what we do. So getting it done right is really important. So if you're not sure, you want the testing done, come see me. Melissa, hey girl. I've been tested for hormone levels in regards to weight loss. Is there tests that you do that other doctors don't? Yes and no. So I say yes because in most cases there's at least 3 or 4 tests that we're doing that other doctors don't. Unless you're seeing a functional medicine doctor, then you're probably covered. If you're not seeing a functional medicine doc, even naturopaths, excuse me, they have their limitations depending on what province or state, in your case, you're in. So due to legalities, some can do some things, some cannot do others, which is why I have nurse practitioners and MDs, because they don't have that same restriction. They can prescribe controlled substances like DHEA, etc. We do LDN therapy, we do the whole gamut. So when you come on board with me to test hormones, I don't just test your hormones, I look at a comprehensive thyroid panel as well, because you need to have the thyroid picture with the hormone picture in order to get the whole picture. We do also a bunch of other testing as well. You know, there's certain vitamins and minerals that we test. We look at your B12, we look at your serum magnesium, your vitamin D. Now, if those come out of whack, then we go a little bit deeper with the testing. You know, then the vitamin D isn't just a 25 OHD, you're looking at 125, and you're looking at RBC magnesium to get a better, bigger picture of it. And we do that with like everything. So even with thyroid, you know, you're looking at getting the full gamut of testing, including your antibodies and everything else, so we know what's going on. Because sometimes your hormone imbalance is a thyroid issue. Sometimes your thyroid issue is a hormone imbalance. So if we don't have the big picture, then we don't really know what we're looking at. So I do tend to say that because we do it all at the gate, we do test more than most doctors. A lot of doctors will test some, wait, and then test others. So you've done throws, and it says I'm normal. What is throws? Oh, thyroid testing. It says you're normal, and you take B12 injections. Okay, so you've done thyroid testing, tells me nothing, and normal also tells me nothing. Because most of my patients, 95% of them, are told that their hormones are fine and their thyroid is normal. And then I have them send me their labs, and I go, but they tested your TSH, and maybe they tested your T4. Well, what happened to the rest of it? Where's your free T3? Where's your reverse T3? Gotta know both those numbers. What about your antibodies? I'd like to see those too. Thyroglobulin, thyroperoxidase, gotta know those numbers. Very important to know those. We test all of that. Those are huge. Because you can't really look at the thyroid if you're only looking at a portion of what's going on. So let me see. I'm going to x-ray your foot because you broke your toe. But don't you want to x-ray my toe too? Don't you want to look at the toe? No, I'm going to look at the foot and the ankle. Okay, but I broke my toe. Like, TSH is thyroid stimulating hormone. Pituitary. It's not your thyroid. It's something that's going to stimulate it, but it's not the thyroid. So it's a great marker, but does nothing on its own. It tells me nothing. That's it. All right. 30 minutes on here, 35 minutes on here. I think I've covered everything. If you guys have any other questions, let me know. If you want to DM me because you don't want to put it on here, that's cool too. Just wanted to make sure that I got that message out there. It's mostly specific to those of us who are in Ottawa and surrounding areas, because Toronto, I haven't really seen much of it. Montreal, I don't really have that many patients in Montreal because I don't speak French. But Ottawa and surrounding area, we're at 3 people so far. That doesn't seem like a lot, but when it's the same thing happening in a small city like Ottawa, it's kind of a big deal. So figured I would do my job as a patient advocate, and I would let all of you guys know what's going on. Now you know. You're welcome, Scotty. Hey, Adam, what's going on? Thank you. Now I'm gonna go, and I'm gonna pour myself a big old glass of water because I'm thirsty for some reason. I need to get me some water. Enjoy your Monday night, folks. Hopefully you're staying warm and out of that crazy wind. It's nuts out there today. I was freezing, oh my gosh, which is why I'm in a hoodie, because I got home and I was like, ooh, there, it's cold. It was a soup night. I should have had soup, but I didn't. We had salad and sushi, which was delicious, but whatever. You're welcome, Melissa. Thank you, everybody, for tuning in. I'm going to post this on my feed. You can give it a watch. You can put your questions afterwards if you have some. Hey, Patricia. Sorry to the people that have joined late. We just went through all of it, and it's awesome. So tune into my ramblings. Anabolic steroids. Watch out. The shit you're getting, not good. If your personal trainer's pushing drugs on you, tell them to fuck off, find a new one. And if they're telling you to take tamoxifen because you're doing a competition, punch him in the throat. Okay, maybe don't punch him in the throat because you probably get arrested for that. But visualize that you are as you pack your shit and leave. All right, that's it. Hey, Alex. Okay, mwah, mwah. Ciao, everybody. Goodbye. I will see everybody when I see you. Okay, that's it. I'm out.